name is Ronnie Decker. I am a registered nurse, and this is Nursing Analysis. Today, we will continue our pharmacology series on the cardiac system, and today we will focus on ACE inhibitors. ACE inhibitors are medications that block the angiotensin converting enzyme known as ACE. The body has a mechanism known as RAS, R-A-A-S, or the renin-angiotensin-aldosterone system. It uses this system to increase blood pressure. Renin is produced and released by the juxtaglomerular cells of the kidneys. When the kidneys sense the sodium level and blood pressure are too low, renin is released into the circulatory system. This release of renin stimulates a protein in the liver, angiotensin, to release. Angiotensin 1 forms from this interaction of renin and angiotensin. Angiotensin converting enzyme is an enzyme found in the lungs that converts angiotensin 1 into angiotensin 2, which causes vasoconstriction. It is also important to mention another function of ACE in the lungs is inactivating a substance known as bradykinin. This substance is an inflammatory substance that dilates vessels, which decreases systemic vascular resistance and lowers blood pressure. It must be mentioned again that bradykinin is an inflammatory substance, and when ACE is active, it prevents this substance and most of its inflammatory properties. Angiotensin 2, as mentioned earlier, is a major vasodilator. Once the vessels dilate, this sends a signal to the adrenal glands and the hormone aldosterone is released. This influences the kidneys to conserve sodium and water, which in turn will raise the blood volume and increase the blood pressure. As a result of this process, potassium will be excreted more by the kidneys, which can cause electrolyte imbalances. So, let's talk about the effects of ACE inhibitors, which oppose the effects of the renin-angiotensin-aldosterone system. ACE inhibitors prevent conversion of angiotensin 1 into angiotensin 2 by stopping angiotensin converting enzyme, also known as ACE. It is very important to understand when we block ACE, it can no longer break down bradykinin. So from a positive action of this, we will get reduced systemic vascular resistance. We will get enhanced vasodilation and decreased blood pressure. But remember, bradykinin is also an inflammatory substance. So if it is not broken down, some patients can acquire that dry, hacking cough that can become so severe they cannot take this medication. So, let's put it together now. ACE inhibitors stop the conversion of angiotensin 1 into angiotensin 2 by blocking angiotensin converting enzyme. This causes accumulation of bradykinin in the lungs. We will reduce systemic vascular resistance and dilate the vessels. Aldosterone will not be released, so sodium will not be conserved by the kidneys. Instead, an overaccumulation of potassium may result. So we must keep an eye on the potassium level, and now the blood pressure is lowered. Let's talk about the therapeutic uses of ACE inhibitors. ACE inhibitors are used to treat hypertension, heart failure, myocardial infarctions or MIs, neuropathy, coronary artery disease, diabetes, certain chronic kidney diseases, migraines, and scleroderma. This is a disease that involves hardening of the skin and connective tissues. We will now discuss the nursing considerations related to ACE inhibitors, like first dose orthostatic hypotension. The patient should be advised to rise slowly, call for help with ambulation, or sit or lie back down if any dizziness or lightheadedness occurs. Any patient taking a diuretic should have the diuretic stopped 2 to 3 days prior to the start of an ACE inhibitor. Taking another antihypertensive medication with ACE inhibitors can increase the hypotensive effects. The treatment should be started with low doses, and the blood pressure should be monitored for at least 2 hours after the initiation of treatment. The cough related to the inhibition of bradykinin must be reported to the MD. Hyperkalemia can occur, so monitor the potassium levels. Remember, potassium's normal range is 3.5 to 5 milliequivalents a liter. Advise the client to avoid salt substitutes that may contain potassium. And if a rash or altered taste develops, notify the MD. Advise that these symptoms will stop once the medication is discontinued. Neutropenia can be noted as a rare but serious complication of treatment. We must monitor the white blood cell count every 2 weeks for 3 months and then periodically. Educate the patient to notify the MD if any fever or sore throat occurs. We will now discuss contraindications to using ACE inhibitors, which include pregnancy, as this medication is a category D during second and third trimesters. Anyone with hypersensitivity reaction, a history of angioedema, and any patient with renal artery stenosis or patients with only one kidney should not be prescribed this medication. Renal impairment or collagen vascular disease puts patients at greater risk for developing neutropenia. These patients should be monitored for signs of infection. ACE inhibitors can also increase lithium levels, so we must monitor these levels to prevent toxicity. ACE inhibitors usually end in pril, P-R-I-L, and here is a list of some common ACE inhibitors. We will now discuss some more important facts to know about ACE inhibitors. ACE inhibitors are usually administered orally except for enalapril, which can be given IV. Captopril and moexapril should be taken on an empty stomach 1 hour before meals. And remember to notify the provider if a cough, rash, altered taste, or angioedema and or any signs of infection occur. Oh yeah, it is now that time again. It's our Rhyme Time Review. The blood pressure becomes low and the body somehow is able to know. To the kidneys, its signal now must go, and renin begins in the vascular flow. The liver helps renin in the beginning, as angiotensinogen is what it is sending. Let's continue this tracing so we can continue the process the body is facing. Angiotensinogen and renin are done once the formation creates angiotensin 1. Angiotensin 1 begins to race en route to the lungs to meet the substance ACE. So what can this enzyme ACE do? It can transform angiotensin 1 into angiotensin 2. From this persistence, we increase systemic resistance. What else results from this release? We will notice the blood pressure will increase, and the breakdown of bradykinin will not cease. Angiotensin is not alone, as its effects cause release of aldosterone. Sodium in water will now increase, as potassium has been picked for excessive release. Let's now discuss the RAS and how to stop it. This is today's pharmacological topic. Inhibitors work in the pulmonary space by blocking the enzyme known as ACE. When we block ACE, the destruction of bradykinin is off, which can produce that dry, hacking cough. The vessels are now dilated as the enzyme ACE is totally annihilated. Aldosterone cannot be released, so the conservation of sodium is ceased. This alternate persistence lowers systemic vascular resistance. Now the blood moves slow as its presence is low. We must watch for the electrolyte potassium, as the body is no longer lacking them. This level will now increase as the kidneys will no longer release. So when do we want to inhibit ACE? When there is a high pressure in the vascular space. It can also be used in a girl or a guy who has suffered from a condition known as MI. It is also used in the signal trail when the heart begins to fail. We must monitor the first dose, which drops the blood pressure the most. Tell your patients to report when things seem off, especially if they develop a dry, nagging cough. As always, thank you for taking the time to learn with Nursing Analysis. Please continue to like, share, and subscribe to enable the production of future educational content. And don't forget to leave any comments, suggestions, or requests for upcoming videos.
Nurses are courageous. Nurses are disciplined. Nurses are compassionate. Nurses are driven. Nurses are motivated. Nurses are independent. Nurses are confident. Nurses are timeless. Let us help you show the world the nurse that you could be. Don't wait. Contact Medical Prep Institute today.